The following portion of Daytime is sponsored by Central Florida Behavioral Health Network, Inc.
For those struggling with substance abuse, it's important to know that help is available, even for life-threatening addictions like fentanyl. And here to tell us about services offered in our area is the president and CEO of Central Florida Behavioral Health Network, Alan Davidson. Alan, welcome. How are you?
Hi, Maggie. How are you?
It's nice to see you. I understand that Central Florida Behavioral Health Network is what's called a managing entity. Can we start there? Tell us what that is and what you do.
Yeah, absolutely. We're a managing entity. We're one of 7 in the state, the largest in population, the second largest in landmass. So we fund a variety of services. Think of us as the safety net because there's many people in Florida that don't have insurance. So we fund from Pasco County down to Collier, over into Hendry and Glades and up into Polk, Highlands, and Hardy. We fund 65 providers and a variety of services from detox to outpatient care coordination and things like mobile response team.
How bad is the situation regarding fentanyl in Florida? Is there a crisis here in Florida?
There is absolutely a crisis. You know, from 2019 to present, the deaths related to fentanyl have doubled. So think about all those substances that people use, like marijuana, opioids, amphetamines. All those are laced with fentanyl, and all it takes is just a little bit, and you don't even know you get it. You know, it's on the pill, it's in the marijuana leaf, and then you get it, and then you overdose, and it's pretty tragic.
How would you be able to recognize that someone might have a fentanyl problem?
So slurred speech, you know, your gait, so as you walk, blackout, then unfortunately blackouts then lead to overdose, you know, paramedics being called.
Are there preventative measures?
There are. Actually, quite a few preventative measures are being seen around the state. Even the governor now has something called a CORE program, and so, you know, where paramedics can come on the scene and attempt to revive you if you've overdosed.
What about resources? So you have a problem, you have this addiction. How can you get out of this hole?
Well, there's a couple things. First of all, the Florida Department of Health, they have some prevention measures on their website that you can look up. And then also at the federal level, there's the U.S. Department of Health and Human Services also has some prevention campaigns. And then you can go to our website at CFBHN.org, and there's a lot of resources on our website.
What are some examples of resources that you can help people find?
Well, we do fund, again, 65 providers. So on our website, there's
all types of providers?
All types of providers. You know, we have Operation PAR, and Centerstone and Axe and Cove here in the Tampa area, over in Polk County, Tri-County Human Services. They are subject matter experts when it comes to things like substance use and, in this case, fentanyl.
It sounds like something really helpful for people who might find themselves in a position of saying, I have no idea where to start. I have no idea where to turn. And it's like a place where you can go and say, okay, this is what you might need, or this is what you might need.
Yeah, you know, unfortunately, again, because people don't know that the drug is laced with fentanyl, they'll take it, have maybe a near-death experience, and then come out of it and wonder, like, where do I turn next?
Exactly.
And, you know, and these are one of those 65 providers that they can turn to.
Excellent, Alan. Thank you so much.
No, thanks, Maggie.
Oh, you're welcome. And if you'd like more information, you can visit the website on your screen, hopeforsuncoast.org. Daytime will be right back.
The preceding portion of Daytime was sponsored by Central Florida Behavioral Health Network, Inc.